Welcome back to News 5 at 11. I'm Rob Powers. Chances are you or someone you love has struggled with mental health at some point. But a new report finds most of Ohio's counties are unequipped to give people the resources they need. News 5's Kaylee Olivas has more now on that new research and what's being done about it.
75 out of 88 Ohio counties are currently experiencing a mental health resource shortage, and that's including here in Cuyahoga County. One local mental health organization tells me the issue is retention and incentivization, saying there needs to be more of it amongst the workforce for the state to be on a better path.
The work that behavioral health providers do is incredibly hard, difficult, a lot of burnout.
And that reflects in this recent Health Policy Institute of Ohio study, especially impacting kids.
There's only 365 child and adolescent psychiatrists working in the state, which is just not many. That's about 1 for every 7,000 kids.
On top of that, research reveals there are only 11 facilities across the state, 2 of which are in Northeast Ohio that provide inpatient psychiatric services. The lead author of this report, Becky Carroll, saying the data is both startling and alarming.
We've always heard that there are workforce shortages, but I didn't understand the extent to which it was a problem.
She says when kids don't receive appropriate and timely mental health treatment, it can result in a crisis. In 2024 alone, more than 5,600 Ohio kids were seen for a suspected suicide attempt.
This is, of course, problematic because without treatment, those conditions can worsen.
Exacerbating these workforce challenges, according to the study, is navigating the complex healthcare and insurance systems, plus finding an affordable provider and beating the stigma surrounding mental health. Jason Joyce, over at the Alcohol, Drug Addiction, and Mental Health Services Board, adds to that, saying professionals are in need of more support, and that's where his organization comes in.
So making sure that they're getting the right training that they need. We also have offered incentives and support for providers in the past as well. Lastly, we allow that Medicaid dollars, so Medicaid pays for quite a bit of behavioral health funding. For the stuff that Medicaid won't pay for, us, the Adams Board, helps cover that cost.
While the board Joyce oversees continues its work, Carroll says more resources like it are crucial. Not only that, but more data on mental health care. With it, she says real change can be made.
Our organization was created to be a nonpartisan and independent entity. We meet with legislators at the state and local level, share the information, and we also love to get our information out to the general public and to advocacy organizations so they can take our information in when they meet with policymakers.
We'll have a list of mental health resources right up on our website. That's news5cleveland.com. For News 5, I'm Kaylee Olivas.